Personality tests can be used to help clarify a clinical diagnosis, guide therapeutic interventions, and help predict how people may respond in different situations. Personality is something that we informally assess and describe every day. When we talk about ourselves, about others, we frequently refer to different characteristics of an individual's personality. For example, we might refer to someone as adventurous, kind, or moody. Counselors do much of the same thing when they assess personality, but on a much more systematic and scientific level. So, how do we define personality? It's changed many times over the years, but what we can agree on is that personality is generally considered to encompass stable and enduring behaviors, which means it doesn't really change much over time. But a ton of experts define and measure it in different ways, and the way that you personally define personality will influence your work with clients, the therapeutic models that you choose to work from, and maybe this leads to the larger, more existential questions of, do you believe that people can change? And if they can, how? And what does that look like? And if you're in the camp that people don't and can't change, then maybe it's time to think about what your goals as a counselor might be. And we can talk about the nuance of words between traits, states, and types. Traits are like the two ends of a spectrum. So withdrawn socially versus loving to be the center of attention, happy versus moody. States are things that shift with time and context. So I'm a little lethargic after I didn't get a ton of sleep last night, but generally I have a very lively, upbeat trait. My state of lethargy will pass and my upbeat personality trait will take over. So maybe think about traits like the default and state like any temporary shift out of that default. And then there's types, and that describes sort of clusters. So extroversion can be considered a personality type that's associated with traits such as social ability, talkativeness, assertiveness, adventurousness, and high levels of energy. The Myers-Briggs personality type indicator test is best known for these types of tests, or tests that look at types, and we'll talk about that one in a bit. Personality inventories are commonly used to identify and measure the structure and features of one's personality or one's characteristic way of thinking, feeling, and behaving. Personality assessment has the same purposes as most other types of assessment, including screening, diagnosis, treatment planning, and outcomes evaluation. Some personality inventories measure specific traits or states, while others evaluate broad dimensions of personality that encompass a broad range of characteristics and attributes. In addition to measurement and evaluation, personality inventories can be used for other purposes, such as increasing self-knowledge and self-understanding. Most personality inventories are self-report, and there's really only two styles. It's either trait approach or projective approach, so we'll talk about each of those. So consider traits as two ends of the same continuum, such as introversion and extroversion. And remember that these are the ones that are more enduring or static, and they're a person's default mode. So trait theory and psychology suggests that people differ from one another based on the strength and intensity of basic trait dimensions. And there are three criteria that characterize personality traits: consistency, stability, and individual differences. So we use trait approaches to help us with the following: understanding the client, making differential diagnoses, establishing empathy and rapport, giving feedback and insight, anticipating the course of therapy, and matching treatments to clients. So a few lectures ago, when I talked about treatment planning and using client strength in treatment planning, trait approaches is a way that you can learn and the client can learn about their strengths. But we probably more often become concerned when traits are maladaptive or abnormal. And the Minnesota Multiphasic Personality Inventory, or that MMPI, is a test that's concerned about uncovering some of those more abnormal traits to help with diagnosis. So just like anything, there's some strengths and some weaknesses to evaluating trait approaches. The strengths are they're easy to administer, score, and interpret. There's robust predictive validity. Most trait inventories are norm referenced, allowing comparisons, and allows us to understand strengths and protective factors in addition to weaknesses. Now, the weaknesses are that there's really little explanation as to why the traits exist, how they develop, or to what degree to each is genetically or environmentally influenced. We don't really understand the why this is happening. We're just sort of identifying the what of it. And trait approaches are sometimes criticized for being redundant in nature. It's sort of asking the same things over and over. Different models predict different numbers of primary traits, so there's really not a lot of cross-referencing between tests or scores. So, some commonly used structured personality inventories include the NEO Personality Inventory 3rd edition. We're going to talk about that on the next slide. There's the 16 Personality Factors Questionnaire, the Myers-Briggs Type Indicator. We've talked about that one a little bit in your discussion boards. We're going to talk about it even more today. Then there's the Jackson Personality Inventory and the Pierce-Harris Children's Self-Concept Scale. So all of these, your book's going to talk about, or you can do a little bit more Google searching to figure out even more information. I'm just going to touch mainly on the NEO and the Myers-Briggs. So the revised NEO personality inventory is a personality inventory that assesses an individual on 5 dimensions of personality, or the so-called Big 5 personality traits. And those Big 5 traits are openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. In addition, this test also reports on 6 subcategories of each Big 5 personality trait, and those are called facets. But historically, the development of this test began in 1978 when Costa and McCrae published a personality inventory. And then these researchers later published 3 updated versions of the personality inventory in 1985, 1992, and 2005. And these revised inventories feature updated vocabulary that could be understood by adults of any education level as well as children. And the inventories have both longer and shorter versions, with the full NEO PIR consisting of 240 items and providing detailed facet scores. So this is a little insight into a scoring scale here. So you can see somebody scoring high on neuroticism might answer, I often worry about things that might go wrong. And maybe this is a good little break here to talk about, like career assessments and unlike IQ tests, there's no right or wrong answer to these questions. There's no perfect or ideal personality. There's nothing wrong with worrying or not worrying. These are just here to help us track and identify what makes each of us tick. Now, when someone is highly neurotic and worried to the point of clinically significant distress, that's where we might start to look at an anxiety disorder or a trauma disorder diagnosis. But again, I sort of hate those words, normal and abnormal, in regards to psychology. There's nothing wrong with you just being you. And even if you meet criteria for a diagnosis, there's still nothing wrong with you or your personality. So the Myers-Briggs, I have a little bit more to say about this one. It's an introspective self-report questionnaire indicating different psychological preferences and how people perceive the world and make decisions. So this one, remember, it's types and not traits or states. It's very popular. It definitely has its fans and its haters out in the world. So since you're all pros at validity and reliability now, I'll let you decide what camp you fall into. The test attempts to assign a value to each of 4 categories: introversion or extroversion, sensing or intuition, thinking or feeling, and judging or perceiving. And 1 letter from each category is taken to produce a 4-letter test result, such as a ISTJ or an ENFP. The Myers-Briggs was constructed by 2 Americans, Catherine Cook Briggs and her daughter Isabel Briggs Myers, who were inspired by the book Psychological Types by psychiatrist Carl Jung. And that should sound familiar to you from your theories course. Remember, Carl Jung, he's the one that was all about analytical psychology, the collective unconscious, archetypes, and as an art therapist, I am here for all of this. He was also super interested in the paranormal, just as a side note, so really interesting. But Isabel Myers was particularly fascinated by the concept of introversion, and she typed herself as an INFP. However, she felt that the book was just too complex for the general public, and therefore she tried to organize the Jungian cognitive functions to make it more accessible to everyone, and that's where the MBTI was born. So most of the research supporting the MBTI validity has been produced by the Center for Applications of Psychological Type. It's an organization run by the Myers-Briggs Foundation and published in the center's own journal, the Journal of Psychological Type. And that just starts to raise some questions of independence, bias, and conflict of interest. So looking at your personality type, we're going to look at these a little bit more in depth, and you can take the test yourself or you can ponder each pairing of the poles. So starting at the top and working clockwise, we start with favorite world. Do you prefer to focus on the outer world? So that would be extroversion or an E, or in your own inner world, introversion or an I. Next one is information. Do you prefer to focus on basic information that you can take in, so that's sensing, or do you prefer to interpret and add meaning? That's intuition. And when making decisions, do you prefer to look first at logic and consistency? That's a thinking type. Or first at people and special circumstances? That's a feeling type. And the last one, structure. In dealing with the outside world, do you prefer to get things decided, it's judging, or do you prefer to stay open to new information and options? That's perceiving. So 2 options for each of the 4 types gives us 16 possible results. I and an M and INFJ. And this is cool in thinking about career assessment, not just personality. There's some information out there in the wild that would tell me that as an INFJ, I'd be good at teaching, counseling, graphic design, writing. So apparently I should also avoid just being an electrician, a restaurant manager, or a military officer. And it sort of seems like it knows me well. Those jobs that it's telling me to stay away from, I actually really wouldn't like at all. So there's a lot of cute things that you can do out there if you know your MBTI type, like apply it to careers, or I guess get paired with your spirit animal. So I am apparently a panda, rare and fascinating, and I just really hope that's true. Okay, so remember how I said that there were 2 styles of assessment, either trait approach or projective approach? We just talked about the trait approach. The next up is the projective approaches. So projective techniques allow clients to project their subjective or true opinions and beliefs onto other people or even objects. The respondent's real feelings are then inferred from what he or she says about others. Projective techniques are normally used during individual or small group interviews, so it's usually not set up like a trait test with yes, no, true, false, or Likert scale responses. It's open-ended. So there's this sort of infinite options of how someone might respond. And the assumption is that they are projecting some part of their subconscious onto us. So almost like we're tricking them into telling us the real truth about their personality. So this, as you might be able to guess, would make scoring really tricky. There are ways to score these tests, but for the most part, we might use them in practice as a jumping off point for conversation, then as a test that determines definitive answer or diagnostic label. And I want you to keep that part in mind, especially when we get to the drawing and art-related projective tests. I have a soapbox to get on when we get there. So the strengths to these are that they're great icebreakers and rapport builders because they're perceived as non-threatening. Clients are not limited in the number or type of responses they can make. Responses are more difficult to fake than for the structured tests, and they may have valuable cross-cultural applications. Their complex, multidimensional themes may emerge and provide valuable insights into the client's personality. The weaknesses are that they're usually expensive to administer, score, and interpret. It takes a lot of time. It takes a lot of training and skill to be able to score these. And subjective scoring and interpretive procedures makes results difficult to replicate. So that's where we look at inner rater reliability or inner score reliability, and either absent or inadequate norms. So basically, because these are also open-ended and a little bit hard to be scored, we don't really have a ton of norms because a lot of times people aren't answering exactly the same ways. Susceptible to outside influences like examiner characteristics or bias and variations in administration directions. So when I'm handing you a piece of paper and I'm sort of measuring for a trait and you answer yes, no, like all of that's going to be the same. It's going to look exactly the same if I hand it to the next person down the row and the next person. But when I'm having a conversation with you about this subjective projective scoring, it's going to look different for every single person, even if all the questions are generally the same. How I ask it, why I ask it is going to be really different. How each individual answers it is going to be really different. So the conversation is going to go to a different place. It's also impossible to study psychoanalytic theory given its emphasis on the unconscious psychological processes, right? So if we're talking about subjective and unconsciousness, how do we even measure that? So there's 5 types of projective techniques. There's association techniques like the Rorschach ink blot test, and we'll talk about that a little bit too. There's a picture story construction technique like the thematic apperception test. Tell me a story about what you see in this image. There's verbal completion techniques. There's choice arrangement techniques like allowing a child to choose what toys to play with in therapy. And there's also production expression techniques. So those are more of the drawing projective techniques like the house tree person. So, the Rorschach ink blot test is a projective psychological test in which subjects' perceptions of ink blots are recorded and then analyzed using psychological interpretation, complex algorithms, or both. Some psychologists use this test to examine a person's personality characteristics and emotional functioning, and it's been employed to detect underlying thought disorders, especially in cases where patients are reluctant to describe their thinking process openly. And after studying 300 mental patients and 100 control subjects, in 1921, Herman Rorschach wrote a book that formed the basis of the inkblot test. And after experimenting with several hundred ink blots, which he drew himself, he selected a set of 10 for their diagnostic value. The Rorschach test is appropriate for subjects from the age of 5 to adulthood. The administrator and the subject typically sit next to each other at a table, with the administrator slightly behind the subject. Side-by-side seating of the examiner and the subject is used to reduce any effects of inadvertent clues or cues from the examiner to the subject. In other words, side-by-side seating mitigates the possibility that the examiner will accidentally influence the subject's responses. And this is to facilitate a relaxed but controlled atmosphere. So there's 10 official ink blots, each printed on a separate white card approximately 18 by 24 centimeters in size, and each of the blots has near perfect bilateral symmetry. So 5 ink blots are black ink, 2 are black and red, and then 3 are multicolored on a white background. After the test subject has seen and responded to all of the ink blots through free association, the tester then presents them one at a time again in a set sequence for the subject to study. And the subject is asked to note where they see what they originally said about the ink blot and what makes it look like that. So this is called the inquiry phase. The subject is usually then asked to hold the cards and they might rotate them. Whether the cards are rotated and other factors, such as whether they're asking permission to rotate them or not, might expose personality traits and normally contributes to the assessment. As the subject is examining the ink blots, the psychologist writes down everything the subject says or does, no matter how seemingly trivial. Analysis of the responses is recorded by the test administrator using tabulation and scoring sheet if required, and maybe a separate location chart. The general goal of the test is to provide data about cognition and personality variables such as motivations, response tendencies, cognitive operations, affectivity, and personal interpersonal perceptions. The underlying assumption is that an individual will class external stimuli based on person-specific perceptual sets, and including needs, base motives, conflicts, and this clustering process is representative of the process used in real-life situations. Methods of interpretation differ. The most widely used method in the United States is based on the work of Exner. And to score, we really just end up looking for themes in words and behavior during administration. So we're going to take a look at a few of these just for fun and to build some insight around the test. I'll leave a few seconds before each one, before I start talking to you, so you can formulate your own responses or opinions of what it looks like. So the very first thing that happens usually when people see the first card is that people will ask what they should do, how they should proceed, and questions about what they're allowed to do with the card. Can they turn it? Some of this may or may not be significant to how you're choosing to score. But since it's the first card, it can usually provide some clues about how subjects tackle new and stressful tasks. It's not, however, a card that's usually very difficult for the subject. It has pretty readily available popular responses. So, when you're looking at it, what do you see here? The common responses are bat, a butterfly, or a moth. So bat, butterfly, or moth, and they always go in the same order. So this one is card 2. What do you think you see? The red details of this card are often seen as blood and are usually the most distinctive features. Responses to this one can provide indications of how a subject is likely to manage feelings of anger or physical harm. This card can also induce a variety of sexual responses. People often look at this one and say that they see 2 humans or different 4-legged animals like a dog, an elephant, or a bear. Okay, and I'm skipping over card 3 and I'm going straight on to card 4 because it's a little bit more interesting and it's really notable for its dark color and its shading. So sometimes that might be a little bit difficult for depressed clients. That's what Rorschach thought. And so this one's generally perceived as sometimes this big threatening figure compounded with the common impression of the subject being in an inferior position. So this serves to elicit a sense of authority sometimes. The human or animal content seen in the card is almost invariably classified as male rather than female, and the qualities expressed by the subject may indicate attitudes towards men of authority. So because of all of this, this card 4 is often called the father card, and people will often say that it looks like an animal hide or skin. And so just because you didn't answer the same way as sort of what I'm saying most other people answer doesn't mean you're wrong, right? We're looking at maybe creativity or openness to new ideas. So if you can find a pattern between how you answered, that's where we sort of look at we're on to something. Sentence completion tasks are another verbal projective technique in which examinees are presented with a list of sentence stems, the beginning of a potential sentence, with a blank space after each stem. So the task is the examinee is to complete each sentence, and the typical way to conduct sentence completion tasks is for the examinee to read the stems and then provide a written response, but oral administration and response is also an option. Sentence completion instruments may range from only a few items like 10 to 15 or 50 or more items. And the basis of all sentence completion forms is that the examinee's responses may provide insight into the individual's self-image, developmental characteristics, interpersonal reactions, needs, and perceived threats. Although published sentence completion instruments yield an overall score, most examiners simply read over the completed sentences and form impressions about what the examinee's responses might signify about their personality characteristics. The Rotter Incomplete Sentence Blank second edition is probably the best known sentence completion instrument. So an example of this might be if I ask you to complete the following sentence. I wish. I wish I had an ice cream sandwich right now. So construction techniques takes it one step farther from completion techniques. We don't give a sentence stem to finish. We maybe just ask for a story with a beginning, middle, and end. And there are some art therapy specific ways to combine construction technique with a projective drawing. And if you're curious about that, schedule office hours with me and I can show that to you. But really the most common construction technique is the thematic apperception test, or the TAT. And the idea here is that the way the client constructs a narrative about ambiguous pictures of people reveal their underlying motives, concerns, and the way that they see the social world. So if you're a fan of constructivist therapies or narrative therapy, you'd probably really jive with this. Okay, so the draw a person test is the first of the drawing projective tests that we're going to talk about. And there's a number of variations, but basically an individual is asked to draw a picture of a person, and results are analyzed to develop hypotheses about the subject's cognitive, developmental, and emotional functioning, as well as their personality style. And this has been used in assessment since Good Enough, that was their name, their last name was Good Enough, created the Draw a Man test in 1926 to estimate cognitive development. And then in 1949, the Draw a Person test was the first instrument to use a drawing technique as a means of interpreting personality based on projective hypothesis. So since that early beginning, a number of approaches have been used, including drawing a person of the same sex, drawing a person of the opposite sex, drawing a person doing something, or a kinetic drawing. But generally the roots of this prompt are that the administrator is requesting children to complete 3 individual drawings on separate pieces of paper. Children are asked to draw a man, draw a woman, and draw themselves, and then no further instructions are given, and the child's free to make the drawing in whichever way they would like to. There's no right or wrong type of drawing, although we want them to make a drawing of the whole person each time, so head to toe, not just the face. And the test has no time limit. However, children rarely take longer than 10 to 15 minutes to complete all 3 drawings. Scoring scales are used to examine the score the child's drawings, and the test is supposed to be considered a non-invasive and non-threatening to children, which is part of the appeal. But as we know, we can't assume that any test would be non-threatening to all. There are plenty of children that would not want to complete this or have high anxiety in doing this for multiple reasons. And the original purpose of the test was to assist professionals in inferring children's cognitive developmental levels with little to no influence of other factors such as language barriers or special needs. Any other uses of the test are merely projective and not endorsed by the first creator. So that we're talking about it as a personality assessment at all is what you might call prescribing something off-label. So this is a sample scoring sheet, and the next slide is a continuation of this sheet. But this is supposed to give you a general concept of what you're to be looking at or looking for in these drawings. And I want you to know that these assessments that read drawings or artwork and are supposed to be able to tell you or tell the client about themselves are often wildly inaccurate and not representative. This is not art therapy, nor are they great markers of reality. The first line talks about where on the paper the figure's placed, and they're saying that if it's high or towards the top of the paper, that means positive emotion and good self-image. What about a child who has short arms and can't reach the top of the paper to draw? Does that mean that they have a depressed mood and low self-esteem? No, it just means that they have short arms. So this is my soapbox. Take this all with a grain of salt. And if you're working with kiddos or adults and their art, it's always best to be curious about it rather than act like you know more than them about it. You could say something like, hey, I noticed that you drew that person in the bottom left-hand corner of the paper, and there's a lot of blank space around them. What does that mean for you? What made you choose to put them there? That's going to give you a lot more information than if you read into it and said, oh, hey, Bobby, looks like you're depressed and you want to disappear and you're pretty introverted, huh? So again, we also want to sort of consider, what is our purpose here? Is our purpose of assessment to know more than the client knows about themselves? Or is it to help the client understand a little bit more about themselves and how they're answering or moving around the world? Because our aim should always, always, always be that we're doing this for the client's benefit, not for our benefit. What good is it if we know more about them than they know about themselves? So maybe just take that as some food for thought. So the house tree person is another projective drawing test, and it's drawing a house, a tree, and a person. And so therapists can choose between a one-phase test where a pencil or crayon is used for drawing, or a two-phase test where that crayon is used in the first phase and a pencil is used in the second. And each phase has two parts, where the first is nonverbal and it's followed by a structured verbal one. So test takers are instructed to draw a house, a tree, and a person as accurately as possible on separate sheets of paper. And then they're asked a number of questions about their drawings. And the researcher here, his name was Buck, he proposed a list of 60 questions. However, trained test givers are free to create their own variations and ask follow-up questions. So, right off the bat, our norms are out the window because we're just making things up on the spot. So here's some examples of the questions that might be asked about the house. So who lives in the house? Do people visit the house? Is it a happy house? What's the house made out of? What goes on inside the house? And the tree, what kind of tree is it? How old is the tree? What season is it? Is the tree alive? Who waters and cares for the tree? And for the person, who is that person? How old are they? How does that person feel? Is the person happy? What is the person like doing? And so the idea behind this is that the house is considered to be the expression of the respondent's family relations and family values. The roof is supposed to stand for the intellectual side and the spiritual life of the individual. The walls might be related to the test taker's character strength. The doors and windows represent the individual's relationship to the outside world and the level of social integration. The tree is thought to suggest the deepest unconscious aspects of personality. The branches might show a degree of social connectedness. The trunk is often seen as a representation of inner strength. The tree crown stands for ideas, thoughts, self-concept. And then the person is supposed to be a symbolic representation of the ideal self and one's social interactions. So the head can be intelligence, communication, and imagination. The eyes indicate the perception of the world, and the hands give information about affectivity and aggressiveness. And again, this is what was originally built to represent There's not a ton of validity here. As an art therapist, and what I was actually trained to do is to look more at dimensions and spaces of part of all three objects than to read into the details. There's a lot of art developmental phases that play into why we wouldn't focus on details. We'd expect a 25-year-old self-identified artist to have much more detail than a 6-year-old, but these tests aren't necessarily normed for age groups or art developmental stages or interest or history of working with drawings. What if you met a 10-year-old that never had the privilege of attending an art class in his life, and suddenly you're comparing him to others who have been playing around with crayons for their whole lives? We need to be careful with cultural dimensions here too. We're assuming that house refers to, like a 2-story brick home with a fence and a garage. Well, what about an apartment building? What if somebody's homeless, or they live in shelters, or they live in their car? Those tests aren't normed to consider anyone coloring outside the lines or drawing outside of the box. It's just, oh, there's no roof, they must not believe in God. Where we know that's not true. And I've seen a ton of houses drawn without roofs as a response to a tornado destroying the children's homes. So sometimes looking at this stuff is apples and oranges. I think it's great to start a conversation, but again, we don't want to read or interpret this for them. We want to find meaning and help them find meaning through their own drawings. And so this last one that I'm going to talk about is an assessment of creativity. And this one it's attempting to measure an individual's potential for creativity, which is defined as one's ability to generate novel and useful ideas. And this is actually a research interest area of mine, not necessarily how creativity links to personality, but more so how creativity as a counselor links to client outcomes and counselor self-efficacy. But the basic idea of creativity is that it's a problem-solving process using an idea that's both unique and novel, or useful or appropriate. And oftentimes there's this aha moment phenomenon where the light bulb just turns off and it's a great idea and it just hits you out of the blue. So the Remote Associates Test, or RAT, which isn't a great acronym, RAT, is a test of creative potential. It was developed by Martha Mednick in 1962 and has since been considered a valid measure of creativity. And creativity is an aspect of personality, more specifically the trait of openness to experience from the Big Five personality model. And it's actually kind of cool. If you want to try this out yourself, just Google the Remote Associates Test. It's a list of 3 words, and you're solving for the 4th word that links all 3. So if I say cream, skate, and water, those are all linked by the word ice. Ice cream, ice skate, water turns into ice. So you get the picture here. Over the years, the RAT, the RAT, has been used to assess various cognitive abilities linked to creativity, including insight, memory, and problem solving, though there's some argument that this test measures sensitivity to language rather than the creative potential. So maybe take a look at it, see what score you get, see how difficult it is. And so to summarize, personality inventories are a method of identifying and measuring the structure and features of one's personality or one's characteristic way of thinking, feeling, and behaving. Personality inventories assist professionals in understanding an individual's behavior with the aim of making some decision about future course of action or to make a prediction about the person's unique future behavior. Counselors can choose from a wide array of personality instruments and techniques, which can be grouped into 3 categories: structured personality inventories, projective techniques, and instruments that assess positive aspects of personality like strengths, creativity, or even gratitude.